Hi everyone, today's topic is rheumatic fever. Rheumatism is used to describe inflammation of the joints, muscles, and fibrous tissues. So rheumatic fever is a type of inflammatory disease that can damage the heart tissues and can lead to rheumatic heart disease. In definition, we can say that rheumatic fever is a type of inflammatory disease that can develop as a rare complication of untreated streptococcal throat infection, which is characterized by polyarthritis, carditis, subcutaneous nodules, erythema magnetum, and Sydenham's chorea. It is caused by a group A beta hemolytic streptococcus. The pathophysiology of rheumatic fever is that rheumatic fever develops in children and adolescents following untreated throat infection with group A beta hemolytic streptococcus. The organisms were first attached to the epithelial cells of the upper respiratory tract and produce enzymes streptolysin that allows them to damage and invade the tissues. These organisms, streptococcus, are covered by a protein called M protein, which is highly antigenic. Now, this means that the immune system sees it and recognizes it as a foreign molecule. The immune response will be activated by producing antibodies against these proteins. Wow. These antibodies, again mistakenly, they further attack the cells of the heart, joint, skin, and brain because the protein covering these organisms are similar to that of the heart, joint, skin, and brain. Now, this is called autoimmune response. Now, some theories will tell you that this condition is an autoimmune disease. It's because of the same reason. Now, this causes inflammation of the affected structures, resulting in inflammation of the joints, which we are calling polyarthritis, inflammation of the heart, which we are calling carditis, skin lumps, which we are calling subcutaneous nodules, reddish rash, which we are calling erythema magnetum, and rapid movements of the face and arms, which we are calling Sydenham's chorea. This inflammation may heal, causing fibrosis of the heart valves, causing rheumatic heart disease. Coming to the signs and symptoms, there will be painful, swollen joints due to inflammation of the joint tissues, chest pain due to carditis, jerky body movements or chorea due to autoimmune in the basal ganglia of the brain, fatigue due to infection, shortness of breath due to carditis, red rash due to inflammatory response of the skin, and fever due to inflammatory response or infection. Well, coming to the diagnosis, there is no lab test that can confirm rheumatic fever. Doctors base a diagnosis of rheumatic fever on the presence of certain criteria. The most diagnostic criteria is Jones criteria, which consists of polyarthritis, carditis, subcutaneous nodules, erythema magnetum, and Sydenham's chorea. Nevertheless, you can also do the following investigations: a blood sample to test for the presence of antibodies to streptococcal bacteria, history taking, which will reveal a throat infection, physical examination may show Sydenham's chorea symptoms, a throat culture to isolate the causative organisms, and full blood counts, which will show high leukocytes. The goals of treatments for rheumatic fever are to relieve symptoms, destroy the causative organism, and to prevent complications. Some theories will tell you that the drug of choice for this condition is cotrimoxazole. However, you can also give antibiotics such as PenV 125 mg QID for 7 days. You can also give non-steroidal anti-inflammatory drugs like paracetamol 10 mg per kg body weight 3 times daily. You can also give corticosteroids in severe heart inflammation. You may give that drug such as prednisolone 20 to 30 mg once daily for 7 days.